I've seen so many people, the patients themselves or their partners or their parents, in-laws, asking me questions like, डॉक्टर कोई इंजेक्शन है क्या जिससे लड़का पैदा होगा? क्या खा सकती हूँ मैं कि बच्चा गोरा साफ रंग का पैदा हो? I'm Dr. Riddhima Shetty. I'm a gynecologist, and today I'm going to bust 6 pregnancy myths that you definitely should not believe. So the first and most common myth I've heard, and I'm sure you have heard too, is that, "Arey beta, now you're pregnant, you need to eat for 2 people." No. You do not need to eat for 2 people. In fact, if the average calorie requirement for a normal person of a standard height and weight and BMI is about 2000 calories in a day, in pregnancy you need to have an additional of only 300 calories a day, or a maximum of 500 calories if you're grossly underweight. And even then, this is not in the first trimester. That means in the first 12 weeks of your pregnancy, you don't need any extra calories. You just have to continue eating what you were eating anyway. It's only in the second and third trimester that you need your extra calories. And that doesn't mean binging on junk food or too many sweet things, because it's not adding any nutrition to your baby at all. You need to eat right and just increase your daily intake by a slight amount. The next thing is that exercise in pregnancy is harmful. I always advise my patients to continue their daily routine and their daily amount of activity that they were doing before pregnancy. If they used to go for walks, if they used to exercise, go for a jog even, I tell them to continue it throughout their pregnancy, unless they are having a high risk or a threatened abortion or a threatened preterm. Only then I ask them to rest it out. Now, this doesn't mean that suddenly you get pregnant and you join a gym and start doing some high intensity workouts, or you're skipping ropes, or you're lifting massively heavy weights and doing a deadlift. Absolutely not. Moderate amount of activity, and whatever you were doing prior to getting pregnant is what you should be continuing throughout your pregnancy, depending on your risk factors. And it's very individualized, so you need to speak to your gynecologist and only then abide by these rules. If your belly is high up, that means you're carrying a girl, and if your belly is hanging slightly lower, that means you're carrying a boy. मतलब क्या यार? It doesn't even make any sense. Why? What is the extra weight in the boy baby that's causing it to hang down? No, really not. Whether you're carrying high or low actually depends on something called as your abdominal tone. That is basically the strength and the tautness of your abdominal muscles. And generally in the first pregnancies, because your muscle tone is quite strong, the pregnancy tends to seem like you're carrying it high up, because the muscles are holding it tautly together. While in subsequent pregnancies, your second, your third, your fourth pregnancy and so on, hopefully no, is when your pregnancy will get lower, because with consequent pregnancies, your abdominal muscles become more and more lax. Drinking milk with a little bit of saffron in it is going to give you a fair baby, or drinking chai or any other darker liquids is going to give you a dark baby. It's just false. Your baby's skin color only and only depends on its genetic predisposition. That means that if it's genetically a hereditary trait of being fair-skinned or having more melanin in your skin. Point number 5. Pregnancy glow, and whether it's related to carrying a girl child. So pregnancy glow doesn't really happen for everyone, because it really depends on your hormonal levels, and a lot of people even suffer from acne and excessive sweating and hyperpigmentation of their cheeks because of the hormone progesterone. And so pregnancy glow happening to everyone is definitely not true. Another myth which is propagated very, very commonly is that eating certain foods will cause you to terminate your pregnancy or cause you to have a miscarriage. The most common example of this is papayas and pineapples. People generally tend to stay away from eating papayas and pineapples because they fear having a miscarriage. So this is very partly true, because raw papayas and a large amount of pineapples is what you would have to consume to actually get uterine contractions, because they do contain certain chemicals which do propagate uterine contractions, but you have to consume them in really large amounts and raw to have to go through this. So if you've accidentally had a few pieces, you don't need to panic, but you don't also need to be like, hey, that's a myth, so I can go and eat how much ever papayas and pineapples I want, because we don't really want to take a risk. But anything in moderation is completely fine. And the next thing is about having ghee. So a lot of women are really loading up on their ghees because they've been told that it really helps in easing a natural birth and delivery. A natural and normal delivery, firstly, it doesn't need to be a vaginal delivery for everyone. In some women, there are a lot of reasons because of which they have to undergo a cesarean section, and none of those reasons are anything to do with whether they're consuming ghee or not. And it's okay if you're getting into a cesarean section, and that's what is the decision made by you and your gynecologist together. And you don't have to blame yourself for your consumption of ghee for it, definitely. And as long as you have a healthy and happy baby and you had a safe pregnancy and labor, you should be fine, and there's absolutely nothing for you to worry about. That's it for today, guys. Bye.
Subscribe to our YouTube channel and hit the bell icon so that you don't miss any videos by us.